Hello, I'm Dr. Trividhi, a doctor working here in this clinic. May I confirm your name and age?
Hi, doctor. My name is Mark Levitt and I am 52 years.
Yes. How may I address you?
Doctor, please call me Mark.
Okay, Mr. Mark. Today we are going to discuss about some health issues of yours. Is that okay?
Okay, doctor.
And during our discussion, I might take down some notes, which will be strictly confidential. Is that all right?
Okay, doctor. No problem with that.
Yes. Mr. Mark, before we start our discussion, may I know that how are you feeling now?
I'm quite okay, doctor.
Okay. And I reckon that you came with some shortness in your breathing. Is that all right?
Yes, doctor. This is not a new problem. For the last 3 years, I am having this shortness of breath, and when I feel the shortness of breath, I sometimes take rest, or rarely I came to hospital and they gave me oxygen. After that, I feel better.
Okay, okay. And do you have have you are you feeling better now? Completely okay? Or
Yes,
just
doctor.
okay? Mr. Mark, may I ask you that do you have any idea what have you been suffering from or about your health condition?
No, doctor.
Okay, and you just come whenever you feel bad and uh, take medication. Is that all right?
Yes.
Am I okay? Mr. Mark, will it be okay if I want to discuss something more about your health condition,
Okay,
that what's
doctor.
going on with you?
Okay.
Okay, Mr. Mark, we have actually tests with you. Okay, so the results show that you are suffering from a lung condition. Uh, will I proceed with it?
Okay, doctor.
Yeah, the lung condition is named as a COPD. Okay, which is known as chronic obstructive pulmonary disease. Have you ever heard of it?
No.
Okay, please don't bother about the term. It's actually a condition, a chest condition, in which your airways through which you take breathe can get damaged. Okay, uh, and it can be a progressive condition. It means that it can go on slowly and slowly. Uh, and once started, uh, the part of the airway which is damaged, it might not get well back. Okay, are you getting me, Mr. Mohammed?
Okay.
Okay. Uh, actually, there can be some more several causes behind it, behind this condition. Uh, may I just go through to find out the causes with
Okay,
you, Mr.
doctor.
Mark? Yes. Mr. Mark, may I know that do you smoke?
Yes, doctor.
Okay. And how many sticks for how long?
About 15 to 20 sticks per day. That is for a long time, doctor. Maybe around 30 years.
Okay. Have you ever thought of quitting smoking, or have you ever found out that it can be bad for your health?
No, I just have been smoking for this long time and I didn't find any problem.
Okay. Uh, Mr. Mark, I am very sorry to say, but actually, the chest condition you have, it can be very much the damage that occurs in your chest due to this condition. It can cause more damage if you continue smoking, and smoking is very harmful for this condition. Are you
So
with
you
me?
are saying that the smoking is causing this problem, or it will cause problem in future?
Well, actually, Mr. Mark, smoking can cause both. Actually, first of all, smoking is it can be a very important cause of this problem. That is one thing, and another thing is that smoking, when you continue smoking, having this problem, it can continue to damage your airways. Are you getting me, Mr. Mark?
Yes, doctor, but I have been smoking for a quite long time. Why this has happened recently? Why didn't happen it before?
Yes, I get it, Mr. Mark. Well, actually, uh, this condition can go on for a long time, and it can be a long time before you develop any problems, that you show any problems. Okay, but within the body, this problem can actually go on for a long time, and actually uh, that may be the cause in you, that may be the thing that happened in you. Okay, that smoking or other causes can damage the airways slowly and slowly, and it can do this for a long time, and after that you might have those symptoms after a long time. Are you getting me, Mr. Mark?
Okay, doctor, I have one question.
Yes, please, Mr. Mark.
I have seen on my one of my senior colleagues. He's taking more cigarettes than me, and for a quite long time than me. But he has no problem with that. So why you are sure that my problem is caused by cigarette?
Yes, Mr. Mark, I'm very sorry to tell you that at this moment we are not quite sure that your problem is 100% caused by smoking. There can be other causes as well. We will try to go to that also. But what I am trying to say is that smoking can cause it, and one thing is for sure, that if you continue smoking after being diagnosed with this condition, this smoking will continue to harm your chest. Okay, your chest condition. Are you getting me, Mr. Mark?
Okay, doctor. So you are saying that stopping the smoking will improve my condition, and I will get relief of it.
Well, Mr. Mark, let me tell you one thing. There is one thing that what the condition you have. This is called COPD, and actually, I'm sorry to say that it might not be reversible. What I mean to say is that the damage that has already occurred, we might not return back it to normal. But one thing is for sure, that if you stop smoking, okay, uh, we can help to uh, control further damage in your chest or your lung. Are you getting me, Mr. Mark?
Okay, doctor.
Well, Mr. Mark, may I ask you some other questions now?
Okay.
Okay. If you are you know willing to quit smoking?
Yes, doctor. If it is necessary, I will quit it.
Okay. And have you ever gone to any quitting program or anything
No,
like that? Sorry.
no, no, never.
Okay. If you wish, I might refer you to the smoking cessation clinic. Okay. Will it be all right? You think?
Okay, doctor. If they can, I will
Okay.
try.
Okay. Okay, Mr. Mark. Can I ask you some more questions now?
Okay, doctor.
Okay. And you told that you have been suffering from this on and off problems for the last 3 years, I think. Am I right?
Yes, doctor.
Okay. May I know that have you ever been prescribed any medication for this?
I was given some nebulizer, and also my doctor said that I have some high blood pressure. For that, they also gave me some medication, but I didn't find any problem, so I didn't take this medication.
Okay. May I ask that you didn't take both medication for your breathing problem and blood pressure, or just one?
Actually, when I told you that I feel sometimes shortness of breath at that time, I take rest, and at that time sometimes I take those inhalers, and that make me feel better. But I didn't find any problem with my high blood pressure, so I didn't took this medication. I think that I took only a few tablets.
Okay. Well, may I ask you that is there any other cause that bothers you taking while taking medication, or why you don't like to take these medications?
No, doctor, I didn't find problem with me, so I didn't take this medication. Just wait.
Okay. And one thing is that you were prescribed some nebulizers, I guess. Okay. So, and were you prescribed any inhalers? Any inhalers? Do you remember anything like that?
Yes, doctor.
Okay, and may I ask you that do you remember which color was it? The blue colored or brown colored?
No, I cannot remember.
That's very all right. I'm very sorry to ask. I was just checking whether you know. Actually, whenever actually this time also, Mr. Mark, we are going to prescribe you some medications. We might prescribe you some inhalers again. And for the condition that you have, it is very important to take those medications and those inhalers uh, in a regular basis, Mr. Mark. Are you getting me?
Okay, doctor.
Uh, well, uh, well, one inhaler might be the blue one, and another we might give you more than one inhalers as well. I understand that it can be a uh, little bit difficult for you to use that. Okay, but it would be very important so that your lung condition don't get worse. Are you getting me,
Yes.
Mr. Okay, and so you will be willing to take these medications.
Okay, doctor. I'll try my best.
Okay, and may I ask you some questions again? What do you do for a living?
I'm a builder, doctor.
Okay, may I know for how long have you been doing this job?
Last 25 years.
And may I ask you that have you been provided with
2 minutes
protection?
remaining.
Have you been provided with any protection for this building?
Sometimes I took those, doctor. I don't find
Okay.
any problem, so I don't take the
Okay.
solace.
Yeah. Well, actually, some when these kind of jobs, okay, these building kinds of jobs can also add to your lung condition, okay, and sometimes it can be the cause of it also. So we will run some tests if you allow us, and we might uh, involve the occupational health department so that they can help you to adjust your jobs so that your health does not get any worse because of your job. Will that be okay with you,
Okay.
Mr. Mark? Okay. And may I ask you some very personal questions now?
Okay, doctor.
Do you drink alcohol?
Occasionally.
Okay. Well, may I know that are you well supported economically and financially?
I think I am.
Okay. And may I ask you again some another question that have you noticed any changes in your weight in the recent years, or you gained weight or lost weight, anything like that?
I gained weight, doctor, and I am gaining it.
Okay. Can you please specify for how long? Can you remember?
I am healthy from my childhood, but recently I am also gaining weight. And last time, that was about 1 year back, I my weight was 100 kg, but this year it is 108 kg.
Okay. And have you ever tried to lose weight?
No,
Okay. Actually, weight can be very dangerous. Increased weight can be very dangerous for your health. It can harm both your lung condition and also the high
time
blood
up.
pressure that you have. Okay. Okay.
So can you please tell me what was your task?
Uh, my task was to convince him about the importance of taking medication and quitting smoking.
Which medication do you think?
Uh, I think about this COPD medication and hypertension medication.
And do you think that he's convinced?
Uh, well, he told okay, so I don't know that whether he was convinced. I think so.
Okay. So is there anything that you could have asked or you should have asked?
Yes, I think I didn't ask more about his blood pressure medication. Okay, I think that that counseling part was not done well, and I asked him that why he didn't take medication, but he didn't specify anything, doctor. So I don't know what more could have I asked. And see, regarding his obesity management, I should have asked some more things that whether he has ever tried to cut down his weight. Okay, and has he ever tried to do some exercise for it, or what type of food does he take? Okay, so cutting down to having a healthy lifestyle of doing exercise, or having fruits, vegetables, and a healthy diet, Mediterranean type diet. This counseling I should have done. I didn't do it.
Okay. Coming to the your point, your task was to explaining the taking medication and quitting smoking. Okay. First, your introduction, that was fine. And you wanted to know about how I am feeling now, how far I know, and I cannot remember that how far I know about my condition.
I asked
Okay.
how much pain.
If I am aware of the test results,
Mm, mm, mm.
you haven't asked it, that if I am
No.
aware of the test results.
Mm,
And after that, you should have should have gone through your main task, that you are going to discuss about a few things,
okay.
about some lifestyle management and some other points with me. Is it okay? You should have given me warning for that. Actually, this was about lifestyle modification, because there were few factors that were hidden. That is, his obesity were given, and his high blood pressure was given. Okay, but in the task it wasn't mentioned. So you should have give me a warning that you are going to discuss about a few things about my condition, and how to improve this condition. For that, what we can do, we're going to about this. Then I get a better explanation or better idea that you are going to discuss a lot of things with me. For that, you should have come for the COPD. Okay. If you come for the high blood pressure, then you can start with that. Or if you started with COPD, you can start with that. Okay. For lifestyle management, for COPD, suppose you have explained it well, that was fine. And after that, if you have wanted to, you should have wanted to know that if I am aware of why why I am having this short breath. Okay. And for the shortness of breath, there were several risk factors, that my already diagnosed case of chronic obstructive pulmonary disease, rather than I have high body weight, and also I have high blood pressure. They are also contributing factor to this. So we should take care of that. Okay. And after that, you should have gone through one by one. That for COPD, there are risk factors. I have told you that first I told you about smoking, then high blood pressure, high body weight. They are causing your shortness of breath. For COPD, we can go for the some programs like your lifestyle modification. And lifestyle modification includes maintaining your good body weight, okay, or nutrition, and stopping smoking, or any products or any inhaled products that aggravates this condition.
Okay.
Okay, then I could get the idea that I need to lose weight, I need to quit smoking, and I need something at job. There are three things that that can be done with COPD. Okay, then you could get a lot of time to explain all of those.
Yes, I actually couldn't just concise the how could I reach all those points. So I was just wobbling around, but I couldn't.
Just from the shortness of breath, you should have tell me that okay, there are several factors that is causing your shortness of breath. That is, you have some problem in your lung, you have high body weight, that is also a factor, and also there are you have high blood pressure. Okay.
Okay.
And we should for this to control this condition, some taking medication alone isn't helpful. We need to for some lifestyle modification or lifestyle management. Is it okay with if I talk about that? Then I could, okay. Then you took the smoking history. Then you told me that yes, there are several risk factors. Okay, I know risk factors. Smoking, I have obesity, I have, and I have to go through the programs. And also for high blood pressure, I need to take these medications regularly. Otherwise, it will my heart and also it will affect my shortness
Okay.
of breath. And for the last 2 minutes, you always should ask about any concern do you have.
Yeah.
Shouldn't explain
Give
everything.
the time.
Even if you haven't completed anything, then you should go for the do you have
Oh,
any concern, because maintaining patient concern is very important.
yeah, 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 yeah.
Okay.
I just couldn't manage time.
No,
I
you could have managed time if you went for that. You are going to discuss a lot of things with me, not only
yeah,
speaking.
it's actually an art. So it's difficult.
Okay,
So
actually,
at the,
this was fine. I think this was fine.
okay, but I couldn't reach all the points because it was a bit haphazard actually. Okay, so I've learned it. That's the approach should be
Actually,
actually. Anybody.
everything is not given here. Just
Yeah.
your task was taking medication and quit smoking.
But I actually have to cover all others also.
Yes, that is for shortness of breath. All these are responsible for shortness of breath, COPD,
Okay.
obesity, and hypertension,
Yeah, 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 yeah. Yeah, that's very correct. That's very right. So I actually
and
okay.
also
So
all risk profession.
yeah, that was very enlightening. So
Just,
thank you.
just at first, if you told me that okay, for your shortness of breath, there are, I'm going to discuss about your management plan with you. That why you are having shortness of breath. Is it okay with you? Okay. Do you have any idea why you are having this? No. Okay. For your shortness of breath, there are actually several factors. We have also found on the imaging test that you have a uh, you have some problem in your lungs, and also there are other factors that is causing it. We'll discuss about that also more. Okay, then we are going to discuss about for management of
Oh,
this condition, for management of your symptoms. We need to give you some advice. We need you need then you will feel better. And is it okay
okay.
with you?
So
If we discuss this condition, then okay. Then
yeah.
I am going to discuss about your some lifestyle management. Okay, lifestyle management, like
Okay.
about your smoking habit, some habits. Okay.
So I think that was